Imagine just pressing a bloody staple gun to your face.
Oh, man. Yeah, it sounds intense.
Right. But the thing is, just 10 years ago, if you wanted the absolute cutting edge in non-surgical skin tightening, that is basically what you were signing up for.
It really was. I mean, it sounds barbaric now, but at the time, people were literally gritting their teeth and paying top dollar for that exact experience.
Just to avoid a surgical facelift, basically.
Exactly. Anything to avoid going under the knife.
And that really gets to the heart of why we're doing this deep dive today. Because if you've ever, looked in the mirror, pulled your cheeks back just a fraction of an inch, and wondered how to get that tightness back.
We've all done it.
We absolutely have.
Yeah.
And when you do, you probably fall right down the rabbit hole of cosmetic treatments. And you are immediately just hit with this wall of overwhelming, highly technical jargon.
Oh, the jargon is wild. Lasers, chemical peels, ultrasound.
Yeah, and constantly this one term keeps popping up. Radio frequency, or just RF.
Which is where a lot of people just, they kind of freeze up. I mean, the sheer volume of non-surgical options out there is completely paralyzing.
So welcome to the deep dive. We have taken a massive stack of sources for you today, and I mean everything from cosmetic dermatology clinical guides to advanced gynecological medical journals.
It's quite the mix of reading material.
It is. But we're doing it to answer one core question for you. Are modern, high-speed, continuous motion RF treatments actually different from those older, painful RF treatments?
And, well, the spoiler alert here is yes.
Absolutely.
A resounding yes.
Yeah, because we aren't just talking about like a minor software update on a machine here. We are talking about a fundamental shift in the actual physics, the application, and above all, the control of the energy.
Right. So we're going to unpack exactly how this energy works and how the devices evolve from those nightmare staple guns to something that, frankly, actually feels like a hot stone massage now.
Which is a huge upgrade. Seriously. And we'll also get into how this exact same tech is quietly revolutionizing women's health. Plus, the very real, very hidden dangers of trying to do this yourself at home.
Yeah, that at-home stuff gets scary.
It really does. But let's start with the absolute basics. What actually is RF? Because I'll be honest, whenever I hear about shooting energy into the skin, my brain immediately just defaults to lasers.
Right, and that is probably the most common misconception out there, but RF isn't a laser at all.
Okay.
So lasers use optical energy. They are highly focused, very specific wavelengths of light. Radio frequency, on the other hand, is pure electrical energy.
Just electricity.
Exactly. It's an alternating current. And in the context of these aesthetic and medical treatments we're looking at, we're talking about electrical energy that oscillates back and forth at incredibly high speeds.
How high are we talking?
Well, in some devices, it's oscillating up to 6 million times per second.
Wow.
Yeah, which we measure as 6 megahertz.
Okay, 6 million times a second. That's a speed that's genuinely hard to even visualize. But when you apply that high-speed electrical current to the human body, what is it actually doing in there?
It all comes down to resistance. So when that electrical current enters your tissue, it doesn't just flow through freely like it would through, say, a copper wire.
Right, because we aren't made of metal.
Right. It meets natural biological resistance. In physics, we call this tissue impedance. And when high-speed electrical energy collides with that natural tissue impedance, the resulting friction actually converts the electrical energy into heat.
Okay, wait, let me make sure I'm wrapping my head around this. So if lasers are like a super precise blowtorch working from the outside in, targeting a specific spot on the surface, then RF is more like a microwave, like heating the tissue from the inside out.
That is a fantastic analogy, actually, yeah. Because for a standard RF treatment, what we call bulk heating, the goal is to safely heat the underlying dermal layer of the skin, usually to somewhere between 40 and 45 degrees Celsius. And if we're talking about RF microneedling, which goes much deeper into the tissue, that temperature can actually hit 55 or even 60 degrees Celsius inside the skin.
That sounds really hot.
It is hot, but we're aggressively chasing this heat because of what it does to your collagen.
Right. The magic anti-aging buzzword. I swear everything always comes back to collagen.
It always does, because your collagen fibers are essentially the structural support beams of your skin, and they have this tightly wound triple helix structure.
Okay.
So think of them almost like coiled springs. When you apply that specific 40 to 60 degree heat, the hydrogen bonds within that triple helix start to actually degrade and unwind.
Oh, wow.
Yeah, and this causes an immediate physical contraction of the collagen fibers.
Which I guess explains that instant tightening effect people sometimes post on social media right after a treatment.
Precisely. You get that immediate snapback. But that immediate contraction is really just the appetizer. The main course happens because this controlled thermal damage triggers the body's natural wound healing cascade.
It tricks the body into healing itself.
Exactly. Your immune system basically rushes to the site, it clears out all that damaged collagen, and then over the next, say, 2 to 6 months, it produces brand new, tightly wound collagen and elastin.
Okay, so I get the heating mechanism now, but I feel like I still have to push back a little bit here.
Sure.
Lasers are incredibly precise, right? And they've been the gold standard for years. So why bother running an electrical current through the skin at all? Like, why not just blowtorch the wrinkles away with a laser and call it a day?
Well, because lasers have a massive blind spot, whereas RF is what dermatologists consider completely colorblind.
Colorblind.
Yeah. So lasers are designed to target specific chromophores. And a chromophore is basically the part of a molecule that absorbs light. And in the skin, the most common target for that is melanin, your natural pigment.
So the laser is literally looking for color to attack.
Yes, exactly. And that means for anyone with darker skin tones, specifically types 4, 5, and 6 on the Fitzpatrick scale, aggressive lasers can actually be incredibly dangerous.
Oh, if the laser can't tell the difference.
Right. It can't easily distinguish between the pigment you want to treat, like a sunspot, and the skin's natural baseline melanin. So this can lead to severe surface burns or permanent hyperpigmentation.
It's awful.
It is. But because RF is electrical, it completely ignores melanin. It doesn't even see it. It just travels right past the pigment, which makes it universally safe for all skin tones, any time of the year.
Wow. Even if you just got back from a beach vacation with a tan, it wouldn't matter.
Exactly. It doesn't matter at all.
Okay, that is a massive advantage. So we've established the foundation here. Electrical resistance creates heat. The heat melts the old collagen, and the body rebuilds it tighter.
You got it.
But a big part of the source material we looked at focuses on the actual delivery of that heat. It seems like the way practitioners get that energy into your skin has just completely transformed over the years.
It has. And this brings us right back to your opening thought about the staple gun.
Right, the nightmare device.
Yeah, because the defining characteristic of early RF technology was a severe lack of temperature control. They relied on what we call a static stamping method.
Stamping.
Yeah. The practitioner would place a square device directly onto a specific spot on your cheek, press a button to deliver a single massive pulse of energy, and then physically pick it up and move to the exact next spot.
Like a post office ink stamp.
Exactly like that.
But that sounds like a recipe for creating major hotspots.
Oh, it absolutely was. The drawback of stamping was these rapid, intense temperature spikes. You had a very high risk of localized thermal injury, which is a polite medical term for actual burns. And it was incredibly painful. Patients routinely describe the sensation as a sharp, intense snap, or like this deep burning prick.
Ouch.
And on top of the pain, think about trying to treat a large surface area. Like if you have skin laxity on the abdomen or the thighs, doing it spot by spot like that took an agonizingly long time.
All right, so enter the newer technology, which is high-speed continuous motion RF. The medical literature we read calls this gliding, right?
Right, gliding.
So instead of stopping and stamping, the operator moves the handpiece in these constant linear or circular patterns over a designated grid. Like, say, a 10 by 10 centimeter square on your stomach.
Exactly.
But I'm stuck on the physics of this for a second. If you are constantly moving the device around, how does the deep tissue actually get hot enough to trigger that collagen unwinding we just talked about?
And this is where we see the absolute genius of modern control systems. Continuous motion RF utilizes a concept called dynamic cooling.
Dynamic cooling. Okay.
Yeah, so by constantly shifting the point of energy application, the very surface of your skin actually gets a micro interval of cooling. You are never subjecting one single spot of the epidermis to prolonged intense heat.
Oh, I see. So you're basically tricking the surface into staying cool, but the deep tissue is still getting cooked.
That's a great way to put it. It essentially decouples the delivery of the therapeutic energy from the risk of a surface burn. While the surface cools for a fraction of a second as the wand glides away, the cumulative heat is still building up deep down in the dermis.
So it's building up over time.
Exactly. It still reaches that therapeutic threshold of 40 to 45 degrees, but it does it gradually. And this transforms a really slow, painful stamping procedure into a highly efficient one. In fact, most patients report that continuous motion RF feels exactly like a warm, relaxing hot stone massage.
Which is a wild upgrade from the sharp snap of the old days.
It's night and day.
And I imagine this gliding motion makes treating large body parts so much more viable. But let's zoom in from the large areas back to the face for a minute, because the evolution from old to new isn't just about the practitioner swirling our hands around, it's about upgrading the micro-level delivery. So let's dig into RF microneedling.
Okay, yeah, because this is arguably where we see the most dramatic technological leaps in the entire field of dermatology.
And this is where that quote I mentioned earlier comes from. One of our sources features a dermatologist reflecting on their very first RF microneedling device from back in 2015. And they are the ones who literally called it a bloody staple gun.
Because it was. The early RF microneedling devices were brutal to endure. They used what we call insulated needles.
Okay, insulated meaning?
Meaning the entire shaft of the needle was coated, and only the very microscopic tip was an active conductor of electricity.
Oh, I see. So if you wanted to treat different depths of the skin, you had to stab the needle in, fire the energy to treat one deep layer, pull it all the way out, adjust the machine settings, and then literally stab the patient all over again to treat a shallower layer.
Yes, it required multiple, painful passes over the exact same traumatized tissue.
No wonder it was bloody. That sounds awful.
It was. But modern devices, like the Sulfamex or Scarlett systems that were in the sources, they completely flipped the script. They use fully conductive needles. So the entire length of the needle emits energy simultaneously.
Wait, but wouldn't that burn the surface of the skin like we were just talking about?
You'd think so, but to prevent those surface burns, they utilized something called the knot effect, named after the South Korean doctor who discovered it.
Right, I remember reading about the knot effect in the notes. It creates a teardrop shape in the tissue. Right. Let's unpack that, because it sounded incredibly dense when I was reading the medical journals.
It can be dense, yeah. But think of the knot effect like a hot air balloon expanding deep under the skin.
Okay, hot air balloon.
So when that fully conductive needle pulses, the electrical energy doesn't just radiate out in a uniform, even cylinder along the needle. Because of how the skin's moisture and resistance are distributed, the energy creates an independent zone of coagulation in the shape of a teardrop.
Interesting.
So the widest, hottest part of that thermal energy, the balloon itself, forms deep in the dermis, exactly where you want the most structural remodeling. And as the energy travels up the needle toward the surface, it tapers into a tiny, tiny point, like the basket of the balloon.
Oh, wow. That is brilliant. So you get this massive thermal shock down deep where the collagen lives, while almost completely sparing the delicate epidermis on top.
Exactly. And you achieve all of that in a single pass. Plus, modern devices give doctors even more control by offering different wave types.
Like what?
Well, they still use continuous waves for that bulk collagen tightening, but they now also use pulsed waves. And pulsed waves allow dermatologists to safely treat incredibly stubborn conditions like melasma.
Melasma is tough, right? Because from what I understand, applying heat usually makes the dark pigmentation worse.
It's notoriously difficult. Heat triggers the melanocytes, making it worse. But the extreme precision of the pulsed wave breaks that rule. It clears the pigment without triggering the heat response.
That's incredible. But let me play devil's advocate for a second here.
Go for it.
Traditional microneedling, just rolling tiny cold needles over the face, that's been around for a long time. It creates micro-injuries, your body heals those injuries, and you get fresh collagen. So does adding the RF heat really make that much of a difference? Or is it just a way for med spas to justify a massive price markup?
No, it is a night and day difference because traditional microneedling is entirely mechanical. You're really just poking tiny physical holes,
right? Which
is fantastic for superficial texture, minimizing pore size, and, allowing expensive serums to penetrate deeper. But when you add the RF energy, you are introducing 55 to 60 degrees of thermal injury.
So you're compounding the mechanical injury with a targeted thermal shock.
Yes. And perhaps more importantly, that electrical energy doesn't just stop at the skin layer. It travels deeper down into what's called the fibroseptal network.
The fibroseptal network?
Yeah.
That's basically the connective tissue scaffolding beneath the skin, right?
Exactly. It's the fibrous bands that connect your skin down to the underlying muscle layer. And when you heat those specific bands with RF, they physically contract and shorten.
Oh, so it pulls everything tighter.
Right. That is why RF microneedling can actually provide a subtle, non-surgical lifting effect to the jowls and the neck. It can also melt and break up dense fibrotic acne scar tissue from the inside out in a way that mechanical poking simply cannot achieve.
Okay, that underlying scaffolding control is really fascinating. And speaking of applying this precise control to new areas, here is where the deep dive takes a really, really unexpected turn.
Yeah, this part is pretty amazing.
We've been solely talking about the face, the neck, and body contouring. But a massive chunk of the literature we reviewed shows that this exact same high-speed RF technology is creating a revolution in gynecology.
It truly is. We're looking at a widespread condition called genitourinary syndrome of menopause, or GSM.
And from my understanding of the sources, GSM is essentially an umbrella term, right? For a cluster of symptoms that occur when a woman's estrogen levels drop during menopause.
That's correct. The biology is deeply interconnected here. The exact same loss of estrogen that causes the collagen and elastin in your facial skin to break down, which results in wrinkles and sagging. That same loss also affects the vaginal and vulvar tissues. This leads to severe vaginal laxity, chronic dryness, burning, painful intercourse, and very commonly, stress urinary incontinence.
Which is when you leak urine when you laugh or cough, sneeze, exercise, things like that.
Exactly.
And historically, the main treatments for this were either long-term hormone replacement therapy, which, some women can't take due to cancer risks, or highly invasive reconstructive surgeries with long recovery times.
Right. The options weren't great.
But now, clinics are using RF wands. So how does a skin tightening device fix stress incontinence?
Well, if you look closely at the tissue biology, the mechanism of action is actually identical to what we do on the face. Using a specially designed internal probe, the gynecologist delivers that same controlled thermal energy to the vaginal mucosa.
Okay, and then the heat does its thing.
Yes. This heat degrades the old, weakened collagen and stimulates a massive localized production of new collagen, new elastin, and critically, new small blood vessels and nerve fibers.
So it's literally regenerating the tissue from the inside out, restoring blood flow and elasticity.
Yes. And regarding the stress urinary incontinence, the targeted heat induces intense tissue contraction in the suburethral area. In fact, one major clinical study we reviewed showed a 30% physical shrinking in the suburethral space after RF treatment.
30%?
Yeah. So think of that rebuilt, tightened tissue acting like a strong physical hammock. That new hammock physically supports the urethra, which significantly reduces or even completely eliminates the urine leakage.
That is genuinely life-changing for so many women. But I did notice something really specific in the clinical guidelines for these gynecological procedures.
What was that?
The medical protocols put a massive, bolded emphasis on the movement of the probe. Like, why is the continuous motion technique so absolutely critical when treating this specific area?
It all comes back to mastering temperature control to prevent thermal accumulation. Think back to the older facial RF we discussed, the static stamping method that caused severe burns.
Like the post office stamp.
Exactly. If a practitioner were to hold an RF probe stationary inside the vaginal canal, all that electrical energy would concentrate in one tiny spot. The heat would build up exponentially.
Oh, wow.
Yeah, you would risk severe mucosal burns, permanent scarring, and even nerve damage.
Yeah, that sounds horrific.
Which is why dynamic movement is totally non-negotiable here. By constantly rotating and sliding the probe in specific sweeping patterns, the practitioner ensures the energy is distributed perfectly 360 degrees around the canal.
So it's spreading the heat out evenly.
Exactly. It provides that exact same microcooling effect we discussed for the abdomen, ensuring uniform, deep tissue remodeling without any risk of localized overheating on the surface. The safety and efficacy of the entire procedure basically entirely depend on the continuous motion of the device.
So seeing how incredibly powerful this technology is, whether you're lifting a sagging jawline, erasing deep acne scars, or literally curing incontinence, brings us to the inevitable catch.
There's always a catch, isn't there?
There is. Professional treatments in a clinical setting are expensive. And I guarantee you, someone listening right now is thinking, well, I saw a device online called the VuityDot, or something similar, for a fraction of the cost. Can I just buy one of those and do this high-speed RF myself at home?
This raises a critical point about what happens when you remove professional control from the equation. The firm scientific answer is no. You cannot replicate professional RF at home.
Right.
And trying to do so carries significant, sometimes permanent, risks.
Well, let's just look at the raw numbers first. We established that the structural collagen you actually want to remodel lives deep down in the dermis and the fibroseptal network.
Right.
Professional devices, operated by trained dermatologists, can push those fully conductive needles and that energy up to 4 millimeters deep into the tissue. Where do the over-the-counter at-home devices tap out?
For basic liability and safety reasons, at-home consumer devices are heavily capped. Their penetration depth is usually restricted to 0.5 to 1.5 millimeters.
Wow.
Furthermore, the actual radio frequency energy output they are legally allowed to emit is drastically lower than a clinical machine.
So at 1.5 millimeters, you are barely scratching the surface. You aren't even reaching the deep dermal layers where the real collagen and elastin remodeling actually happens.
You aren't. At bed, you might trigger some mild temporary inflammation that gives you a superficial plumping effect for a day or two, but you will not achieve any meaningful long-term tissue tightening.
But the lack of results isn't even the primary concern here, is it? The safety risks are staggering.
They really are.
Because we dove into some Reddit threads from users of these at-home devices, and frankly, it was a bit of a horror show. There were endless complaints about severe heat rashes and localized burns from people just holding the device in one spot for too long.
Which just proves our point about why continuous motion is required.
Exactly. But the most terrifying complaint I saw across multiple forums was unintended facial fat loss. People were posting pictures looking completely gaunt and hollowed out after using these tools.
That is a very real, well-documented clinical danger. RF energy is highly effective at causing apoptosis, which is programmed cellular death in adipocytes or fat cells.
Oh, wow.
RF devices in the clinic, specifically for body contouring and melting unwanted fat on the abdomen or thighs.
Wait, but you definitely do not want to melt the youthful fat pads in your cheeks. I mean, that's what gives a face its volume and youthful structure.
Exactly. You want to preserve that facial fat. And the clinical data on this is incredibly precise. At 43 degrees Celsius, you begin to trigger delayed fat cell death.
Okay.
At 45 degrees Celsius, for just 3 minutes, you permanently destroy 60% of the fat cells in that specific targeted area.
Wait, 60%. So by holding a cheap mail-order device on your cheek for 3 minutes while you're distracted watching Netflix, you could permanently hollow out your face.
Yes. In a professional clinic, a dermatologist meticulously controls the exact temperature and the precise depth of the energy delivery. They ensure the heat stays confined to the dermal layer to build collagen, deliberately avoiding the subcutaneous fat layer. Unless, of course, fat reduction is their specific goal.
Right, which it isn't on your cheeks.
Exactly. At home, using a device with limited safety controls, if you use improper technique, apply too much pressure, or hold a static device in one place for just a minute too long, you can accidentally drive that heat straight into the fat layer. You will permanently melt away the structural fat in your face,
leaving you looking much older and much more hollow than when you started. I think it is incredibly safe to say leave the high-speed radio frequency to the professionals.
Without a doubt. The precision required to balance therapeutic heat against permanent tissue damage is simply not something you can get out of a mail-order box.
So what does this all mean for you, the listener? If we zoom out and look at this massive stack of research, the leap from the older, painful RF treatments to modern high-speed continuous motion RF is profound.
It's a totally different world.
By utilizing dynamic movement and micro-intervals of cooling, modern RF maximizes the cumulative heat deep in your tissue where you actually need it, while completely eliminating those dangerous thermal spikes on the surface.
Exactly.
The result is a treatment that relies on absolute control, making it infinitely faster, safer, and far more comfortable. Whether you're trying to rebuild the collagen in your face or restore vital function to the pelvic floor.
And if we look even further down the road, what's truly fascinating here is the underlying premise of the technology itself.
How so?
Well, radio frequency proves that our bodies are, at a foundational level, electrical systems that respond to very specific frequencies. Right now, we know how to use 6 megahertz to essentially trick our skin and tissue into behaving like it did 20 years ago, synthesizing fresh collagen and elastin.
Right.
But it leaves you with a really profound question. What other regenerative cellular processes might we be able to unlock in the future simply by finding the correct electromagnetic radio station to tune into?